Hi guys, today we are going to talk about approach to CT interpretation. So let's begin. So what is CT or computed tomography? We would not go into the details of CT physics as these are not required for basic interpretation. Just remember that CT is use of X-rays to obtain cross-sectional slices of body. Let's first talk about slice thickness. See these two images. The image on the left appears smoother, whereas the image on the right appears more grainier. However, if you focus, you'd realize that spatial resolution of the image on the right is much better. You can see how the stomach wall is much better defined in the right image than in the left one. If you cannot recognize stomach for now, it's okay. The image on the left is thick section image. So we can conclude that thick section images provide smoother images, which are more pleasing to look, but they, however, lose on spatial resolution. Thin sections, on the other hand, provide much better spatial resolution. Thick sections, being thicker, result in fewer images, leading to smaller file sizes. This is advantageous for a quick overview, but may overlook critical findings. In contrast, thin sections provide more detailed images, enhancing diagnostic accuracy despite larger file sizes. Now let's move on to one of the most fundamental concepts, that is Hounsfield units. Hounsfield units are numbers that tell how dense a tissue is, that is, how much X-ray it attenuates. For example, bone is very dense, its HU is very high, but air is not. Its HU is low, denser the tissue, whiter it appears. Thus, we can conclude that colors on the CT images depend on HU of that particular tissue. Now here in this image, we can look at the attenuation of different tissues. The attenuation of rib is measured at top, which comes out to be 362 HU. Then air is seen on leftmost corner, which reads negative 987 HU. Liver shows an attenuation value of 53, and fat, which is measured just anterior to spleen, shows mean attenuation value of negative 108 HU. Look that both fat and air are looking dark. Now in this image we can see the attenuation value of bile, which is fluid, measured within the gallbladder, which came out to be 18 HU. Attenuation of contrast is shown, which measured 139 HU, and that of paraspinal muscles is also shown, which measured 56 HU. Now that we know about HU, let's talk about windowing. Our eyes can differentiate between limited shades of gray and what are CT images but shades of gray. On a CT image, since air is minus 1000 HU, totally dark, and cortical bone is plus 1000 HU, totally white, it's very easy to differentiate between them. But what if the HU difference between two tissues is very slight, like tissue A is 40 HU and tissue B is 50 HU? Now both will appear gray and our eyes won't be able to differentiate them clearly. Here comes the concept of windowing. Suppose you're sitting by a window, looking at a wide landscape that stretches from bright sky to dark ground. You can't see everything clearly at once. Your eyes adjust to either the bright part or the dark part. If you focus on the bright sky, the ground looks black. If you focus on the darker ground, the sky looks washed out. It's just like when you walk indoors after being out in bright sunlight. For a few seconds, everything inside looks pitch dark. Your eyes were adjusted or windowed for high brightness outside, so they can't pick up the lower light levels indoors. After a while, your pupils readjust. Your window shifts, and now you start seeing details inside clearly, but if you look back out the window, the outside suddenly looks blindingly white. This is similar to how windowing in CT works. We adjust the brightness that appears on screen for different tissues as per our requirements. Now let's talk about previous example, where the difference between 40 HU tissue and 50 HU tissue was very minimal as compared to that between AIR 1000 and cortical bone and 1000. Now what we can do is select a window center, which can be 45 HU. It'll appear mid-gray. No, we can select window width, say 20 HU. So now our window will stretch from 35 HU to 55 HU. Everything less than 35 will be black, and everything more than 55 HU will be white. All shades of gray will be distributed between 35 to 55 HU, and thus contrast will be better appreciated between tissues having close HU values of 40 and 50 HU. This is an illustration showing the concept of windowing again. Here we see that all the grays are distributed within a narrow HU range, which we call window width, Everything outside that window appears either black or white, and center of this range is called as window level or window center. And extent of this range is called as window width or window range. Soft tissue window. We want to see muscles, organs, vessels, all around 40 to 60 HU. So the window level, center, is set near soft tissue HU, approximately 40, and the window width is moderate, approximately 400 HU, to include both slightly darker and lighter tissues. Arrow air and bone fall outside this range, so air looks black and bone looks white. In the lung window, focus shifts to low-density structures like air and lung parenchyma. The window level is set around -600 Hounsfield units, with a wide window width of 1,500 Hounsfield units. This range captures everything from air at -1,000 Hounsfield units to soft tissue at +500 Hounsfield units, highlighting lung details effectively. In the bone window, attention is on dense structures. The window level is set around +400 Hounsfield units, with a wide window width of approximately 2,000 Hounsfield units. This setting highlights subtle variations in bone density, while other structures, such as soft tissue, become less distinct. DICOM viewers provide preset window width and center values for different tissues, simplifying the process. These presets can be manually adjusted to enhance image interpretation, allowing for precise visualization of specific structures. This flexibility aids in accurate diagnosis by highlighting relevant anatomical details. CT windowing is crucial for image interpretation, determining which Hounsfield units appear as shades of gray. The window level sets the central Hounsfield units, focusing on specific tissues like soft tissue, lung, or bone. Window width adjusts contrast. Narrow width enhances contrast, while wide width reduces it, affecting image clarity. Thank you guys. I hope you liked this video. Follow us on www.4by11.com for more educational content. This was our first video. We would obviously try to improve in future. Do give your feedbacks and suggestions. Let's learn radiology together. Thank you and over for now.